Hi folks, for part 2 of medication and depression, let's have a look at tricyclic antidepressants, or TCAs as they're sometimes abbreviated to. So in this very short presentation, I'll talk about tricyclic medications. So like SSRIs, they work to increase the amount of monoamines in the synaptic gap. However, rather than causing a blocking on reuptake of the monoamines, they disable the transportation system. So it's just a different mechanism, but the same general idea in terms of how these medications work. So tricyclics are inhibiting a different mechanism, and that has impacts on the type of side effects that you see. Have a look at the table below, and you'll see some of the common tricyclic medications that you've probably come across in practice, and the different neurotransmitters that are impacted along with maximum dose. You see that there's quite a difference from SSRIs, in particular in norepinephrine or noradrenaline, whatever one you want to call it. I should probably say that, it's easier. You also see there's a different maximum dose. Now that can depend on the severity of the depressive episode. It can also depend on where the patient is taking medication. So for the lower maximum dose, the patient might be managed at home, whereas for the higher maximum dose, they might be managed within the hospital setting. And that generally relates to the danger roundabout side effects, which we'll come to a little bit later. So to reach the best therapeutic level, then tricyclic should be introduced in a low dose and increased slowly to the therapeutic dose every 3 to 5 days. When there's a steady therapeutic level observed of the medication, then it is possible to take a single dose of tricyclics at bedtime. Tricyclics have a relatively long half-life. And if you don't know what half-life means, that basically means the amount of time it takes for the medication's concentration in the plasma to reduce by half. So they basically last a little longer in the bloodstream. Like SSRIs, as we talked about, it can take 7 to 28 days for the tricyclics to be effective. Yet similarly to SSRIs, the increase in monoamines in the synaptic gap is immediate. So again, an issue just with the serotonin theory, or the monoamine theory and hypothesis there. Side effects of tricyclics can be more pronounced than SSRIs. Due to their action, it is very common for them to cause weight gain and drowsiness in particular. I think that's an important consideration for us as nurses about how we manage people who are going on to medications like this, how we educate them about the possible side effects and lifestyle choices that they need to make. There's also a number of other side effects in terms of dry mouth, constipation, anxiety, sexual dysfunction once again, and a range of other side effects. These medications are known to inhibit sodium channels in the body, and thus they can cause cardiac problems. This is the most important side effect, is this a reduction in the heart rhythm, and this can cause serious cardiac issues for patients. So these medications then are very unsuitable for patients with pre-existing heart conditions, and of course very dangerous and overdose due to cardiac toxicity. This is why generally SSRIs are more commonly used, because they're less dangerous in overdose. Patients may ask again if tricyclics are addictive or not addictive. The message would be that they're not addictive, but similarly to SSRIs, they have the same issues with discontinuation syndrome as we previously explained in other slides.